Hello, everybody. Nice to see some of you getting in, some familiar faces and some new. I'm Dr. Elena Klemenko, for those of you who didn't meet me before. We're going to talk about Polycystic Ovarian Syndrome today, or PCOS. The reason we decided to talk about PCOS in the month of March is because March is the International Women's Month, right? Everybody probably heard about International Women's Day that we celebrated on March 8th. And we had a really big celebration here at the office where every woman received the flowers, and we're just trying to make sure all our women are very happy during the month of March and every month, of course. But this is their very, very common problem, the PCOS, and it's one of the leading reasons for infertility that is so rampant now in the United States and in the world itself. So that's another reason that PCOS can be so devastating for so many of my clients and patients and friends, because more and more women are getting this diagnosis and the treatment options are pretty limited. So as people are coming in and joining us, I would like to share some slides. And I see some new patients. If you want to just pop in and ask me some questions, you can unmute yourself before we start the lecture. Otherwise, you would have to wait until the end of it. So go ahead. This is an opportunity to unmute yourself and ask anything you want about either PCOS or the practice in general. Well, I guess we don't have any questions. I don't know if it's good or bad, but it is what it is. And we're gonna start with the slides. Let me just share my slides with you. And while we're waiting, I just want you to type on the bottom in the chat box, how did you find out about us? How did you learn about this event? What motivated you to join specifically this event, specifically this topic? So if you want to type this in the chat box, that would be really helpful for me to understand and serve you better. Okay. All right, so demystifying hormonal dysfunction and infertility, or a natural approach to PCOS, or I should say not so much natural, but more of a functional medicine approach, because we still, in functional medicine, we do tend to focus on lifestyle and genetics and environment and relationship and the lifestyle and the food, of course. But we also looking at the conventional treatments and possibility of an understanding of what is the mechanism of action of a specific condition, and in this case, Polycystic Ovarian Syndrome. So it's actually very interesting. When I was preparing for this lecture, I learned that at least 70% of women with the Polycystic Ovarian Syndrome remain undiagnosed in the primary care setting. So many of us, it means 7 out of 10 women, would come to their gynecologist or to their primary care doctors, and they will never be screened or even suspected to have this condition, though they will have their evidence of this condition in their presentation. So we're going to talk about what is PCOS and what are their possible complications of the PCOS in the future for the women who have the features of PCOS or Polycystic Ovarian Syndrome. How do we develop it? What are the common mistakes when their PCOS is diagnosed? And also we'll talk about treatment options from the conventional as well as from their alternative or functional medicine approach. And we'll touch upon our program for women with PCOS who are willing and ready to take their charge of their health. So So what is this polycystic ovarian syndrome? It's actually the web of different conditions happen during their PCOS. And so what we see is actually it's a hormonal imbalance, we know that is increasing the risk of infertility. And sometimes, not always, it can present with the cysts in the ovaries. But more and more we see women who do not meet the standard criteria of their having the cystic ovaries on the ultrasound, but they do have all other features, and this is like a conglomerate of the features. They usually gaining weight uncontrollably. They have this abdominal obesity. Those are all features of the PCOS. They might have irregular periods. They often present with a high cholesterol, even at the younger age. And all of that leads to their increased insulin level. And as a result, that can also increase their testosterone. All of those features of the PCOS are kind of tangled into this web that we see. And unless we have this understanding, the web understanding of all these features, weight gain, high cholesterol, insulin resistance, and high testosterone or male hormones, some women can present with all of those features and some present only with few of the features. But all of it can kind of lead to the PCOS. And I want to make sure my slides are progressing and you see them. Sometimes it doesn't. But all of those characteristics that I just described, or processes that are underlying the diagnosis of the PCOS, will eventually spill into the certain symptoms. And that's when women would come to the primary care doctor or gynecologist with the complaints of acne or unusual or unwanted hair growth on the chin, on their abdomen, on the arms, on the legs, excessive hair growth. That's a feature of the PCOS. They also can have this irregular periods that are usually not, or the periods become longer and longer. And some women will start skipping the periods. Some women will present with their early onset of the high blood pressure, obviously weight gain. Some women will present with the fatigue, and of course, infertility. And as you can see on the picture on the right, you will see this apple-shaped adiposity or gaining weight in the abdomen is a very characteristic hallmark characteristic of their PCOS, more so than the pear shape that is on the right. So, and of course, it wouldn't be so problematic, but there is a really strong correlation of women who are diagnosed with the PCOS early in life, in their childbearing age, that in the later on in life, there's a really strong association with developing diabetes or insulin resistance, developing cardiovascular complications like ischemic heart disease and coronary artery disease, metabolic syndrome, infertility that I already mentioned, and also sleep apnea and even depression. So it's a web of their conditions that are linked to PCOS. And how do we get to the PCOS? It doesn't really happen overnight. It's not like the bug bit you and overnight you woke up and you have a PCOS. Of course, it's a slow but progressive illness that is developing due to the variety of the condition. And some women will have a strong family history, meaning they have a genetic predisposition, but it doesn't always take 100%. It takes maybe only 20% of their reason why women develop PCOS. What is a much bigger role, the factor in the women who develop PCOS is really actually the lifestyle and diet. And that's why we promote and educate our clients here so they understand that they can take a full control of reversing the PCOS and keeping it under control with the diet and lifestyle, as well as with their controlling the environmental exposure and stress. So all this web of the events that we discussed that is on the left side of your slides, all the symptoms and mechanisms that lay behind the PCOS are controlled by the factors on the right. And please remember that Your genes is not your destiny. You might have a family history, but not everybody with family history will develop PCOS. A lot of it has to do with all other factors that are listed here. So yes, so family history, usually women with PCOS might have family members that had problem with infertility, or the first degree of relatives might have some symptoms of PCOS. It could be just abdominal obesity, not necessarily infertility. And interestingly enough, the male family members will have a history of type 2 diabetes. That also could be a factor for some of the women with the PCOS. So yes, genetics do play a role, but it's not the destiny. It's much more important how we live our life, what we eat, because with food, we send a message 3-4 times a day. We send a very potent message to our body. And either we eat food or we're skipping the meals will affect your PCOS. So skipping meals, as well as eating the processed food, will have a detrimental effect on the blood sugar regulation. So the blood sugar will be swinging up and down, and that will cause their production of a very important hormone called cortisol. And cortisol will affect our blood sugar as well, and will release insulin. So remember that graph that I showed in the previous picture where PCOS is heavily affected by insulin. So higher the insulin, higher the risk of the PCOS. So what we eat will affect our insulin level, and that will affect their risk of developing of PCOS. Or just an opposite, if we skip the meals and our body is going through the stress, and that causes the release of cortisol, and cortisol will cause the release of insulin, will also affect the PCOS production. So the net result of this, what I'm trying to describe here, is that high insulin will cause the high blood sugar and will promote the progression of the PCOS. And that, at the same time, will increase the production of testosterone, and women will get a lot of those unwanted symptoms of acne or unwanted hair growth. So what's on your plate will heavily affect the risk of PCOS. And maybe you've heard about that. Oh, yes, we know that insulin will affect the progression of PCOS, but this is something that maybe many of us didn't even suspect, that our environment can play a dramatic effect on the progression and increased risk of PCOS. We live in a very toxic soup of their environmental pollution. You probably know how many chemicals are released every year into the air. These chemicals are not being controlled or tested how they affect our health. So many of those chemicals are actually work in our body as hormones, just like insulin or just like estrogen. So we actually, on the double effect of the hormones from our own production, which our body does really well and balancing it really well on its own, but now we're getting all these chemicals from the environment, BPA or estrogen mimicking industrial compounds, or POPs we call them, right? Persistent organic pollutants will work in our body as the hormones. We call them endocrine disruptors because our body detects them as a hormone and actually bind to their receptor sites of the hormones and work just like insulin or other hormones. So our environment, what we drink, what we eat, what we come in contact with, what we put on our skin, is filled with the toxins, and those toxins affect our hormonal balance and also potentiate the risk of the PCOS. So please, when we work with our clients, we teach them what chemicals to avoid in their environment. We ask all of you to review your cleaning products, review your cosmetics, remove that, especially if we're dealing with the PCOS and fertility. And of course, the fourth very big factor is the stressors. And it could be physiological stress as well as the psychological stress. And the way the stress affects our body and leads us to PCOS is, of course, through the cortisol. Cortisol, as I said, will increase the blood sugar as well as the blood pressure. We basically under effect of the adrenaline, right? When we're in stress, and that's fight or flight response, we get the high blood pressure, we get the rapid pulse, we at the same time we decrease our immune defenses, we stop our digestion, and of course the response to stress will help us to survive as long as it's a short living. Unfortunately, in our new environment that we're all trying to survive and be resilient to it, we are under stress much longer than for a split second or split minute. We are under stress 24/7. So that will cause just reset our hormones and reset of our insulin and our glucose level, and will lead us more and more to PCOS. So that is really, really important. When we work with our clients with PCOS, we address the stress and we work with how we can mitigate the stress. And of course, stress comes in all different phases. It could be stress related to the sleep disturbances. We find ourselves more and more watching TV too late, looking at our screen, diminishing our melatonin level by looking at the blue screen or watching TV. We are under physical stress of inflammation. Our food inflamed us. We have problems with our microbiome in the gut. We get skin problems. All of those things are signs of impending inflammation in the body. Autoimmune disorder, as you probably know, we're in an epidemic of autoimmune disorders, which causes inflammation and adds to the stress, mental, emotional stress, anxiety, depression, just worries about how we're going to live tomorrow, how we're going to make our living, restless mind that I think is heavily affected by exposure to electromagnetic field, and also the blood sugar imbalances due to the food that we eat or the meals that we're skipping or eating highly processed food. All of that are the factors of the stress on our body. And of course, the chronic inflammation that I mentioned before, some of you probably know this slide. Inflammation is our important mechanism for us to survive, and it's extremely helpful if, let's say, you broke the leg and we need to heal. That peak of inflammation that you can see on this slide on the left will help us to heal faster, right? But then this inflammation is supposed to subside on the day 30. But what happened with the chronic inflammation, we never resolve the inflammation, and it just keeps piling up high in her, and we end up being very, very inflamed and aging faster when the chronic inflammation is there. And there's many different factors that contribute to this chronic inflammation. Aging itself is their pro-inflammatory condition, but again, we are going back to microbial burden, toxic burden in the life that contributes to inflammation, and the food that we eat can be either pro-inflammatory or anti-inflammatory. So addressing inflammation with PCOS is also extremely, extremely important. Another condition that is really worth to mention is the sleep apnea. It's also a diagnosis that goes on diagnosed and untreated very commonly, and it can contribute to the development of PCOS and stress and sugar dysregulation, as well as the abdominal obesity. So the signs and symptoms you're probably familiar with is fatigue, this daytime sleepiness, sometimes nighttime gasping, choking, snoring. If you sleep with a partner, ask them if you are snoring. And now many of us are using the wearables at night, so you can detect your oxygen saturation as well as the heart rate that can vary if we experiencing sleep apnea. So all those things are now helping us to diagnose and monitor our sleep and making sure we're getting a restful sleep. So that's something that is also very, very important. Now, the diagnostic criteria of PCOS could be can be difficult sometimes. And not two cases of PCOS are the same, because for some women, PCOS might be driven by toxins, and for other women, it can be driven by insulin resistance. So there's a lot of mixed knowledge about this. And there's also overlapping conditions with the thyroid disease and the congenital adrenal hyperplasia that should be diagnosed by their physician. So other causes definitely need to be ruled out. But this is something that causes a lot of confusion in the conventional medical setting. And sometimes that's why they overlook PCOS in many, many women. So what are the treatment options that we have for their PCOS? In conventional treatment, of course, there is some pharmaceutical medication that will help you to manage risk factors like high cholesterol or elevated sugar or blood pressure. Women will be offered some medication that will suppress those symptoms. Sometimes a most common way to approach PCOS, especially in the younger population, is just to put those women on their oral contraceptive pills. Oh, honey, you don't have your regular periods. Let's put you on the oral contraceptive pills, even if you're not sexually active. Let's suppress the hormonal function of your ovaries and stay on it, and your periods will be regular, and will be suppressing your male hormones production without really looking at the reason why woman is so much out of balance. So, and sometimes, some really advanced primary care doctors will tell women, well, go and lose your weight and stop eating junk food, and maybe you'll lose some weight and start exercising. It's all about calories in, calories out. That's the approach that conventional medicine usually promotes. But in functional medicine, we really take a person, and a woman in this case, and we are trying to understand what is her risk factors. Why did she develop PCOS? What led her? Is it the sugar dysregulation? Is it stress? Is it all of the above? Is it there are other factors? So we developed a personalized diet plan. We encourage and motivate women to start moving and exercise. We help her to remove and manage stressors. We cannot remove the stress from our life, but we can raise our resilience. And we have a multiple interesting mechanism how we help our patients to build the resilience. One of them is building the heart rate variability through the HeartMath practicing. So all our patients have an opportunity to be trained and practice it on a daily basis to build that resilience and keep our possibilities better. And also, of course, we're looking at their toxic exposure, endocrine disruptors that cause so much oxidative stress and ultimately lead to their faster aging and other problems in the body. And this is actually a very typical case that I wanted to share with you. June K came to visit me because she had PCOS, and she was offered conventional treatments, and she didn't really want to do it. So here's her case. So she's in college. She's very busy and very anxious because she has this very, very hectic schedule, and also she's working part-time to pay for her school. So she started experiencing hair growth, unwanted hair growth on her chin, and she developed acne, and her period became more and more infrequent. And when she went to her primary care doctor, she found to have elevated hemoglobin A1C, which is very common. So it tells us that she has insulin resistance. Her doctor actually ordered an ovarian ultrasound, and there was no ovarian cyst, so she didn't qualify for the criteria of PCOS. But still, she has a concern about how the PCOS will affect her future plans, including her fertility, because she knows we get more and more of younger population who go and read Dr. Google, and they become much more educated and motivated to take a charge of their own life and their own health. So she knew that she's meeting some criteria for PCOS, and she wanted to look what else she can do and take control of her own health. So with the functional medicine approach, what we did was start looking for upstream triggers. What are her triggers? And in her case, we definitely found that she has stress and she has some sleep issues. Really difficult time to fall asleep and stay asleep. She also found to have some gut health issues and nutritional deficiencies. And then every new patient in my practice will work with a health coach. It's a part of our initial visit and access membership for those patients who come and join us for a year or more or longer. And the health coaches will help to implement the changes that were explained specifically for her case. And so the outcome in the cases of functional medicine approach is really a natural balance and the control of their PCOS symptoms and the sex hormone balance, and most importantly, controlling that insulin resistance by utilizing this root cause approach. And even though the contraceptive pills can help, we can wean our patients off the contraceptive pills, and so they don't need to use it, at least for the PCOS. And so many women, young women, come being on oral contraceptives for decades with not even needing contraceptive effect, but using it for just the hormones balancing. And that's really not the most natural or efficient way to help women to live healthier hormonal life. And of course, we now know that there's a strong correlation with their hormonal or endocrine cancers on women who've been on oral contraceptive for a long time, as well as the fertility issues. So the PCOS is the really complex web of mechanisms that I want you to understand and learn and empower you, that knowing that you can actually influence the outcomes of the PCOS. So a lot of cases of infertility that I solved in my practice were done through this lens of controlling their sugar, detoxifying women from environmental factors, controlling their insulin resistance, and improving hormones and reducing the testosterone. So, and we do it through this program that we take our patients through. We meet them for at least an hour and a half to take the initial intake. We're ordering some conventional testing, as well as their specialized testing. For PCOS, we utilize some of their functional medicine hormonal testing, either salivary or urine testing with the Dutch test or ZRT test. We're looking not only at their sex hormones, estrogen, progesterone, testosterone, but also at the cortisol and their curve of the cortisol throughout the day, which is really hard to do in a conventional setting, because you would have to draw your blood. You would have to have your blood drawn 4 times a day to detect the cortisol level. But with the functional medicine testing, it's much easier. So we do prescribe supplements and lifestyle intervention that, as I mentioned, the health coaches will help to implement. And some women will receive some homework. And of course, our patients are encouraged, and we put a lot of effort to teach our patients how to eat healthy and cook at home and enjoy their cooking and have fun with their partners, their family, or that even in their own, to have fun cooking at home and eating healthier. We also offer some group visits in our practice, and every new patient is actually receiving not just individual health coaching sessions, but also group coaching visits. So if you're ready and if you want to take the next step, I would encourage you to communicate with our office and take the assessment quiz to see if you might have some features of the PCOS. You can watch more videos on my website about the PCOS, or just call our office and speak with our client assistants to schedule an appointment. You can also see their newsletter on my website. Sign up for the newsletter, and you can follow us on social media. So if you have any questions, we're gonna have a little bit of time for that, but I just wanted to give you a little heads up about their special promotions that we want you to take advantage of. This is the 10 days glucose reset that includes 3 products. All 3 will help you to reset your sugar cravings and help to control the glucose surges, and will give you an understanding of how can you feel when your sugar is actually well regulated. So you can get that through their either our office or through the e-commerce store that it's basically you can access it through my website. There's a little tab called e-store. Please use this 10% off discount for this wonderful set of their glucose regulation. And of course, we always talk about reset and rejuvenation and detoxification through the 5 days fasting mimicking diet. I'm a big proponent of this intervention. I do it myself on a regular basis to keep myself in shape and control my cravings, improve my body mass, improve my cellular cleanup and rejuvenation, stimulate my stem cells, and regulate my immune system. All of that, all of those wonderful features come from the fasting mimicking diet that you can also order at the best possible price through this link that is listed right here, prolonfmd.com/Dr. Klemenko. You'll get really one of the best prices on the market if you order it through this link. So, and for those of you who already tried those fasting bars that are studied actually and confirmed that if you want to do a fasting, intermittent fasting, you can wake up and actually take one of those bars with either black tea or black coffee, nothing added. It actually prolongs your fasting time. So it's a really great product that we also utilize and teach our patients to use. So for their new upcoming lectures, please make sure you sign in for our next live Q&A that will be outlining the autoimmune condition and how you can either get a control of your autoimmune condition if you have one, or prevent autoimmunity. As one of my teachers said, if we live long enough, we will all end up with autoimmunity. So it's great to know earlier what you can do to delay that onset of autoimmunity in our lives. And of course, it's done through the food. And remember, if you remember, I mentioned the HeartMath series, which is their great way to learn how to balance your stress and how to help your body to get out of stress through their heart rate variability. Our teacher, Janie Terry, she's our health coach and certified educator in HeartMath series, will be teaching it on the March 15th. So if you're interested, you can sign in. It's going to be our second lecture out of the 2 series, 2 lectures. So we all participate in that, and I encourage everyone to use it and build the resilience through their HRV or heart rate variability. All right. So we also offer group coaching. For new patients, it is free, and for existing patients, it's only $20. And you get an opportunity to join our community, ask questions, learn from each other, and of course, you'll have an experienced health coach who can help you to deal with any of the barriers you might have in your journey towards optimal health. Genetic testing that we recommend for all new patients to have done. This is the 3x4 genetic test that helps us to guide our patients to their future, kind of like a glimpse to the future and develop a program that will help patients to take care of the vulnerable pathways to prevent the development of chronic medical illnesses. We do not screen for their genes that are responsible for the disease, but we are looking at the pathways that can lead people towards the disease. So, and we teach patients how to navigate and how to make your genes to work for you, not against you. So this is the great program that is led by our genetic expert, Marina Kucher. She's a physician assistant and a certified functional medicine practitioner. And as a thank you for you joining our live Q&A today, I would like to offer you a 10% off on our e-commerce store, which is shop.dryelenaklemenko.com. And please record this code so you can use it and order and shop through the whole store with this 10% discount. So, and with that said, I am certainly open to questions and answers. And I see that I have a question here. I discovered you via Google by looking for functional medicine practitioner. I'm interested in seeing one due to the host of things that have popped up in the last year or two. It seems there may be a root cause instead of continuing to merely treat symptoms. Absolutely, you're on the right path. We want to go upstream and we want to find what are your reasons for all these myriads of symptoms, right? I'm also getting older, like all of us. Hopefully we're all going to get older and age gracefully. And also would like to optimize my health. Yes, this is the right place to optimize the health, and I would strongly recommend that 3x4 testing, so we can look into their future a little bit, kind of like lifting the curtain and looking into the future and understanding what are your vulnerability and where do you need to pay attention, because it could be different for some women or men. It could be bones, and for some people it could be working with the detoxification pathways. So it's very, very important and helpful. I get extremely great feedback from my patients, especially those who want to optimize their health. So you called the office and inquired, and the lady who answered the call sent you to this live Q&A. So I'm happy to virtually meet you as well. Thank you very much, Tiffany, for your question. And if any of you have a question about specifically PCOS or any other conditions, or how to become a patient, please feel free to unmute yourself and ask me, or just type it in there in the chat box underneath. I see that some Mark is here. Hi, Mark. Nice to see you. I'm glad you were able to join today. Even though it's for women, but it's actually for all of us, because the principles are the same. We need to eat healthy. We need to avoid environmental toxins. We need to learn how our body is destroying itself for the stress, and how can we build our resilience through their lifestyle, through their simple techniques of diaphragmatic breathing or deep breathing, or taking some adaptogenic herbs or nutrients to feel more resilient. So if you don't have any questions, this is your last chance to ask a question. I want to wish everyone a wonderful weekend. Thank you very much for tuning in today. We will be here on the March 24th to discuss possibility of how can we delay the development of autoimmune conditions. And many of my clients already have autoimmune conditions. They don't even know about it. And we'll see more and more of that, unfortunately, after their series of some conventional interventions that many of us got exposed to in the past few years. So autoimmunity will be rampant. So it's great for all of us to take proactive steps to prevent the progression of autoimmunity. So you're welcome, Lenore. Nice to see you. Do I have a guidance around choosing a plan to become a patient? It all depends on your needs, and it depends on your budget, because basically for people who already have insurance or have possibility to be reimbursed by the insurance, for example, if you have out of network benefits, it would be much better for you to be a fee for service patient. But for other patients who don't have out of network benefits with the medical insurance, it's great to have this payment plan and work with us for a year. It's pretty affordable if you do it that way. Can you explain again the connection between PCOS and thyroid? And do you have any natural approach to treating subclinical hypothyroidism? Absolutely. So the connection between, I'm going to give you a short answer because we are running out of time. The connection between PCOS and thyroid is through the cortisol. High cortisol will block thyroid hormonal production, and it will specifically block conversion of T4, which is inactive hormone, to T3, which is active hormone that's supposed to bind to the cellular membrane receptor and stimulate the cascade of the changes within the cell. So that's the connection: high cortisol, thyroid issues, right? And there's many other mechanisms, but yes, those conditions go hand in hand together. Very common. And treating subclinical hypothyroidism, definitely looking at their nutrients. Many of us are iodine deficient, zinc deficient, selenium deficient. During our initial visit, we evaluate many of those nutrients. So some of the patients will get prescription for improving nutritional status right from their beginning. So that's a part of our initial evaluation. All right. Well, thank you so much for joining me. If you want to call us, please feel free to call us. Marty, who is actually on the call, will be taking your calls, and she will be happy to answer any of your questions. With that, have a great weekend, everyone, and I hope to see you all in my office. Bye.